came back to the United Kingdom when I was 2 and went back again when I was 9. And then my mom decided it was best because I started getting very, very sick when I was living in Nigeria. It was a point that it was just not manageable. Because in Nigeria, I went to, my mom was living in the United Kingdom and my dad was living in Nigeria. So he was taking care of us. In that process of my dad looking after us, um, who's doing fine with managing sickle cell. But I think it got to that when you get to that teenage part of your life, when I was 13, and I started wanting to do what everybody else was doing. I wanted to do what my sisters was doing, and I wanted to be a rebel. But being a rebel with sickle cell was not something I would advise anyone to do. So I was just trying to go out, and I had to go to secondary school, started puberty and everything. And that was when my sickle cell really, I understood I had sickle cell at that age because I would be sick every day. My father, poor thing, poor man, didn't know what to do with me. So he asked my auntie, my mom's sister, okay, could I go to secondary school in Enugu, Nigeria? If you know Nigeria, if any of you from Nigeria, hello guys, if any of you are from Nigeria. So I went to my auntie to live with her, and my condition just got worse. I remember I was weighing only 40 kg, and I've always been very slim, but this one I went extremely slim because I didn't understand that there were things I needed to do. And as I couldn't understand why they were force feeding me, they were making me drink water in the middle of the night, and making me drink water in the middle of the night made me want to wee. But anyway, to fast forward, I came back to the United Kingdom when I was 18, and I've lived here ever since. And life was still very much a challenge for me because living with sickle cell and you're moving from Nigeria, that's hard, and coming over to United Kingdom, that was a massive, massive challenge. And I never thought I would have kids, or never thought I could aspire. I would go into all of that and how all of this affected me. But to fast forward to who I am today, I am a successful businesswoman. But I started from nothing. I started with just the sheer determination that I wanted to be not that person that people defined as the sick girl, the skinny girl, the distant. Something in me said to me, you know what, Anne, you could be better, you could be rise against all this. Don't let your past define you. So I'm a successful businesswoman. I run a big consulting firm called the Rise Consult, which is where we advise companies in Africa on how to do business. Then I also have a company called Painless Universal, which is really about helping people overcome their pain. I wrote a book about living with sickle cell, and that was where really that was taken well. It was one of the bestseller in the UK because the way it was written from an honest perspective. I didn't try to omit any. Writing the book took me 4 years because I wanted to omit a lot of things about my life. I thought, why should I tell everyone this is what I went through? Why should I, give the dirty part of my life to people, especially, the part that I bet I was, wetting the bed until I was 16. It's just so many disgusting habits that you form over time living with sickle cell to numb your pain. But I remember my sister reading the book and said, this book doesn't make sense. That it's very empty, that you're missing out every part of your life, that unless you're writing this book to tell a fairy tale story, it's fine. So to cut the long story short, I wrote this book. It was endorsed by the WHO Director General, and it was endorsed by so many other people who really took this book and said, this is a real story. And I'm really glad I did put myself out there. And it's called Painless, Living with Pain and Finding Joy. I'm really glad I'm joining you guys on this platform because I want to share my own mental story because it hasn't been easy. But through having great people around me, great friends, great mentor, and even this place where we have these chats, because I keep needing it. So again, I don't know what else to say, but my name is Anne Welsh. I am glad to join you guys this Sunday morning to talk about the mental aspect of living with sickle cell.
Thank you. Thank you. Thank you so, so much.
Yeah.
Ms. Anne.
Thank you.
Thank you. I think we'll just go by people who I can see across the screen. If we can just introduce ourselves before we go into a presentation. And Rachel will be coming shortly. The next person I can see is Sharif, Tiona, Peter, Natalie, and then we'll go to Dr. Anki Shetty, who's joined us. Oh, Rachel is here. So Sharif, please introduce yourself and how you're affected by sickle cell. Thank you.
Thank you very much for having me here. My name is Sharif Tesurida. I'm in Lawrence, Kansas. I'm a sickle cell advocate from Kampala, Uganda. I work with the Owen Sickle Cell Association of the Midwest here and have sickle cell 0 beta thal. I'm glad to be here to talk about my mental health experience as well. Thank you.
Thank you. Tiana.
Hi, my name is Tiana Wolford. I live in Baltimore, Maryland. I am a psychology student and a sickle cell advocate. I have sickle cell genotype SS. And what motivated me to start majoring in psychology, I work really closely with the pharmaceutical companies over here, and I know that they are working on gene therapy and perfecting transplant, and there are 40 new therapies coming down the pipeline, but none of them address the mental toll that sickle cell takes. So that's what motivated me. And I think I spent a lot of years just kind of surviving and not really living or not really thriving. And I didn't realize that that was depression until I got older. And I went through a bone marrow transplant and I rejected. And, you know, I had a lot of dark times, and I'm just happy that I overcame all of that. And I'm excited to share this platform with all of you.
Thank you, Tiana. Peter.
Yes, good day, everybody. My name is Peter Shikoya. I live with sickle cell. I'm HBSC, and I work with an NGO called Sickle Cell Advocacy and Management Initiative. So I came into advocacy. I grew up with a single mom who also lives with sickle cell. She's SS, and I had stories of rejection from my dad's paternal family just because she lives with sickle cell, saying that I won't survive, she won't survive, and in their own family, sickle cell warriors, they don't want them to marry sickle cell warriors because they die early. And okay, so growing up, going to school, I started seeing people or warriors who tend not to know anything about themselves, parents treating themselves, their child wrongly without knowing what to do and all of that. So I decided to start learning about, okay, what does this sickle cell mean? How can I help people who already have this condition to become better? Because I found out that a whole lot of people were just surviving, so to speak, and they were not truly living their potential. And insurance were even, to a large extent, streamlining the possibilities that their children are supposed to have. So that's how I joined a sickle cell club in Surulere. It's at Lagos University Teaching Hospital. We target Surulere Sickle Cell Club, where that was headed by Professor Kehinde before he retired. That was where I learned the basics of sickle cell, and one way or the other, people started telling me that I should tell my story, share my experience. I tell people, okay, I don't have experiences, but I saw physical experiences with other people. So it brought me into, okay, where can I do all these things? I can't start an NGO because I have sickle cell. Let me look for people who do these things and share my knowledge with them. So that's basically how I came into advocacy. And I've been a volunteer with the sickle cell NGO for about 9 years. I've been learning about sickle cell for about over 15 years, so to speak. And that's my brief journey till now.
Thank you, Peter. I think the next person I see is Natalie.
Okay, hi everyone. So I'm Natalie. I am part of ASCA. I'm actually the board secretary. Agnes and I I joined Agnes in ASCA a few years ago. So Agnes and I are basically a tag team. She's definitely the front face that a lot of people see. I'm the martyr behind, I say. So yeah, very much a strong partnership. How I came involved with this is that I am the mother of a young daughter who is affected by sickle cell disease. And it has been a very difficult journey, from the caregiver point of view. I still struggle, I will say, every day. But having this platform has definitely helped me, because my goal is to make sure that we move forward, we move the needle. That as I mentioned earlier, I personally would not like to speak about this in the next 30 years. And for my daughter, I think about, the type of life that she should have, that she deserves to have. I want her to thrive. I want this to be a small part of what she is. Yes, of course, it does form a big part of who she is, but I definitely don't want this to be the focus of who she is. So my goal is always to make sure that she has all the resources necessary for her to do well, and to enjoy all the opportunities that can be available to her. And obviously that does extend to other people who are in the same boat as me and her. Thank you.
Thank you, Natalie. That's big. Thank you so much for sharing. Dr. Ankeshetty, thank you for joining us. You are next for
myself.
Yes,
good morning, everyone. Good evening, wherever you are. Yeah. I'm
Good
so
morning, Ma.
pleased. I'm delighted. It's a privilege to be with you. I didn't think I would make it. Normally, Sunday mornings are my lie-in mornings, and I go into church later in the afternoon. But I'm glad. So forgive the way I look. Just rushed out here. But having said that, fantastic. This is very, very good. And I think it sort of gets better and better every time. Thank you very much, Agnes. I know a few faces here already. Agnes, I know you. I know you like you're my little sister now. I know Natalie. Peter is my son. Timmy is my daughter. And who else? I know you. You came to Nigeria with the Obasanjo Foundation. Do you remember? Some years ago. And I really, really admire you. You're a wonderful woman. You just told us a tip of the iceberg of who you are. There's so much to know about you, and your life is an inspiration. And it's from people like you that I would like to draw all that inspiration. I'm a public health physician. So first and foremost, I'm a doctor. I still practice clinical practice. I see patients, but in public health, I find my voice because I'm able to connect with people and listen to their life stories and all the issues and try to see how can we prevent disease. Let's speak of health and prevent illness. So rather than look at medicine from the medicine point of view, we and a few of us in the preventive health space look at it from the health space. How do we prevent illness? Preventive medicine. So that's that. I'm the National Director and CEO of Sickle Cell Foundation Nigeria. I haven't been in the NGO space for some time, just for about 5-6 years now. Prior to that, my life's work was with government, with the WHO, and with the United Nations. So in a way, I have experience working globally. But I think it is so important that I work locally, where I am much more needed. And I see that. In the Sickle Cell Foundation Nigeria, we're an NGO, but what we have done is really kind of step in and fill the gap that it is obvious that government has left. Nigeria, as you know, has the highest burden of sickle cell in the world. And yet, sickle cell is not a top priority. I happen to have been director of HIV and AIDS at the national level for many years. And I recall, I think I've shared with you, Agnes, how partners world over would fall over themselves to support the HIV and AIDS cause. It's not the same for sickle cell. But the good thing is we're getting there. We have kind of inserted ourselves into the group called non-communicable diseases control group. So we're kind of piggybacking on that to give ourselves some prominence. There's non-communicable disease alliance global, and we, the sickle cell group, we're already part of it. And I'm making sure, because I'm involved with them, that we are never left behind. One of the reasons they didn't want us in the first place was they said, come on, we don't see sickle cell as one of these non-communicable diseases. If you talk of cancers, if you talk of hypertension, if you talk of diabetes, you can kill many birds with one stone by saying what? Look after your lifestyle changes, your diet, your exercise and all that. But you couldn't do that with sickle cell. But we argued, we lobbied, we negotiated. That is what life is about. So if I'm talking with a group like this, I always like to share with younger mentees that whenever you find yourself on any platform, when you find yourself at a seat, at a table, take advantage of it, because that chance may not come again. Push your voice, push your agenda. Nobody will push your agenda for you. Now, we have World Sickle Cell Day today. Took a lot of fights in 2006, 2007, 2008, all those years. I happen to have been, I think, in the right place and the right time. And I joined that strong lobby of African nations, mostly, I must say here, French-speaking African nations. They were in the forefront, more than us Anglo-Africans. But I joined them, and I tell you, we talked till our mouths were dry. But that is what life is about: lobbying, getting people to talk, join you, talking to the people on board. And today we have what we call World Sickle Cell Day, celebrated on June 19th. So it's a lot of all that. And in my foundation, Sickle Cell Foundation Nigeria, we do a lot of advocacy. We go to schools, we go to communities, advocacy with government, because government, let me tell you, if you don't have government on your side and get what is this thing we call political will, your agenda would not move. You'll be working on the fringes. You'll be working on the fringes. It's government that does policies. It's government that comes out with the big plans and so on. But what we have done is write policy documents and pass it through the back door to the government and say, go ahead and say you did this, and bring it out and say this is policy for sickle cell. But this is happening and is working little by little. We have guidelines for the control of for the treatment, management of sickle cell that we developed ourselves in Sickle Cell Foundation Nigeria with support of WHO, and pass it through the back door to government and say, look, go ahead and say it's yours, endorse it, put it out there and say these are what we call Nigerian guidelines. And you don't have to reinvent the wheel. There are guidelines all over the world. Now, what I found was missing and very critical in the guidelines for management and control of sickle cell is the mental health aspect. Mental health aspect, and it is big, it is huge. We've come a long way. As a younger doctor in the 80s, I happen to have been the first desk officer for sickle cell in the Ministry of Health. We would go around and ask for trying to do a survey in the community. How much sickle cell do we have in Nigeria? We didn't see any. Why? Parents were hiding their children. They wouldn't come out. So we had no count. And so we were saying, okay, give us figures, give us statistics, and we can use that to fight for you. But we had nothing to show. Why? Because people were hiding. How many, maybe 3 decades or so down the line, I think things have changed. What I'll say, there's what we call name recognition. When you go into the communities today, you'll find parents, families come out and say, my child has, they may not call it sickle cell, some call it sickle cell already, but they'll give you the name, Arumolegu, depending on where you are, or they would say Abiku or Banje, but they come out. They're looking for help. So it's there. That's what I call name recognition. We've come that far. There's also this aspect. If you look at mental health aspect of sickle cell, where is it coming? It is something that runs right through the life's course, from birth through childhood, through school age, through high school, university, when they start getting into relationships, having children, and so on, right through the life's course. And anything that we talk about regarding mental health issues has to address each and every of these aspects of the life course of anyone with sickle cell.
Thank you, Dr. Annette.
Thank you.
And again, I'm so mindful of time. So I think I saw when I sent through the run sheet, there's just 1 or 2 or 3 questions that we wanted to answer before we go into Rachel's presentation. I think I'll pose it to the panel again, starting with Peter, what we understand about the topic today. What's your understanding of mental health? Peter, please. Thank you.
Yes, my understanding of mental health is that it revolves around a whole lot of things, ranging from our emotions to our emotions in, relating to sickle cell, because I relate to a whole lot of sickle cell warriors, and I found out that the factors that affect their mental health is not just that they live with sickle cell. It's the social aspect, is the environment aspect, is the workspace aspect. So, in trying for us to improve on our mental health, we need adequate information. We need more professionals. We need more access to professionals in the field and all of that. So basically, mental health is taking good care of your mindset and your emotions.
Thank you. And I'll just limit it to like a minute whilst we are answering the questions because we are mindful of time. So and the next person I can see is Sharif. What's your understanding of the topic today? Thank you, Sharif.
So my understanding is that mental health would relate to psychological, behavioral disturbances, which may be associated to sickle cell in this case. That's how I view this. Thank you.
Thank you. Tiona, you're next. Thank you.
I think my understanding of mental health is kind of what's already been said. It's just how you are psychologically and emotionally. And I wholeheartedly believe in the mind-body connection. So I know that when my mental health is not okay, I'm not okay physically.
Thank you. I've got Anne Walsh next. And what's your understanding of mental health? Thank you.
And for me, mental health is how you feel and think, how you process, how your mind processes things. It affects your mind, it affects your emotion, it affects socially as well. So mental health for me is everything. Everything encompasses, bringing it all together, how you connect your mind and your well-being. That's psychologically how you connect everything together. That's how I process my mental health.
Thank you. Natalie, you're next. What's your understanding of today's topic?
I don't think I really have much to add, to what has already been said. Definitely, I do believe that mental health does have a huge impact on physical health. So I'm definitely a strong advocate on being aware of our mental well-being and having strategies in how to cope to avoid any stresses, that might manifest physically.
Thank you. So I think at this point, what I wanted to do, Dr. Ankisheti has done a very good introduction of the topic already. She spoke about what they are doing in their foundation. And just quickly, I sort of, Natalie and myself, we sort of looked at the team on this panel and just seen what you guys are doing in the community. As I said, Peter, I just connected with him a few days ago on social media, and I've seen what he's doing. I've seen Tiona, who's, so I'm talking about now the people that are actually affected by sickle cell, what you're doing in your community to say just how you guys have become role models. And if you can talk about a time that you actually also down and to where you are today. I feel that's why I was inspired to sort of encourage you to come and discuss this topic with us. Timmy, thankful for Dr. Ankisheti. We also connected after Dr. Annette connected with me, and I've also seen what you're doing on social media. So you're sort of all role models in your own capacity, and what way to come together and just discuss where you felt like we all have a story when you are down at your lowest point and where you've come from and how you've become to who you are today, because most people are looking at you and what you've done in your community. So that's why you guys are on this panel, and I thank you so much for coming on the panel. I have other questions that we had. I think we'll discuss that after Rachel does the presentation. I'm just mindful of, and after Rachel does the presentation, And then we'll go into Anne to present about her journey and how she's written a book before she can leave us. So at this point, I ask Rachel to introduce herself quickly, and then she'll go into doing the presentation. Thanks, Rachel.
No worries. Thank you so much, everyone, for having me on this panel today. My name is Rachel Masiboy. I live in Australia, and I am a Zimbabwean by origin, and I live here. I've been working as a mental health clinician. I'm psychology and social work trained. I do most of my work in primary mental health. I'm in private practice, and I also work part-time for Corrections Victoria. And I'm involved with doing lots of therapy work with people that are living with chronic disease, including sickle cell, cancer, HIV and AIDS, sugar diabetes, to mention but a few. So this is where I'm coming from. Just to facilitate on how living with a chronic condition can actually affect your mental health, and also to give you some pointers. I'm not doing therapy work in 20 minutes, but I can give you some pointers on where to get help and what sort of help could be useful to you during this journey of surviving sickle cell. Yes, okay. I normally use the word survivor. So I know that you guys are using warriors. So if I use survivor or warriors, it's the same one and the same thing that I'm talking about. So okay. I'm going straight into my presentation today.
Yes, I've given you the co-hosting powers, so you can go ahead. Thank you.
Oh, you know what? I hadn't sorted that one out. So do you still have my slide there?
I'll look for them. I thought you had them. So once I'm looking for them, I know I'll find them shortly. I think I'll ask the second question. And what's your understanding of, or actually we'll jump that up because I'm just trying to be mindful of time. As I said, I've chosen you all guys because of what you've done in the community, but there've also been a point where you've been like your lowest point and now you've come out of that state and where you are today. Maybe just starting with everybody who can, maybe Timmy, you did say briefly how you are.
Hello?
Yeah, I can hear you. We can hear you.
Hello, okay, I can hear you.
No,
okay,
yes, go ahead.
Yes, it froze. It froze. I'm back on now. Okay, so yes, I've had times when I felt like my mental health was at the lowest. I started in secondary school when I was bullied through secondary school by my peers, just because I was seen as a weak child. Then when I finished school 8 years ago, having to go through a broken engagement, you know, feeling like all hope was lost for me at that time. And then even recently, having to lose my mom also was my very lowest, was me at my very lowest. But apart from that, there are many times I have been ill and usually when I'm ill, I go into, I go into a lot of sorrow and sadness. So it's mostly this sadness from me being down again that affects me. Yeah, that's my experience in a short description of how I've had to go through me at my lowest times.
Okay. Thank you, Rachel. For me, maybe I can come in here. I haven't really spoken. Well, I have written about my story, like I've done an article on LinkedIn. For me, to be honest, I was a mess when my daughter was diagnosed 5 years ago, but I always say this, you know, I can't even imagine to be in the shoes of you guys who are living with sickle cell. But as a caregiver as well, just like as Natalie said, we also go through emotions, and there's also emotions of blame. Like you start asking yourself, if I had known, would I have done something different? And so for me, it took 5 years, to be honest. It took 5 years. I saw some psychologists. I was put on antidepressants, and it did work. But I realized when I started telling people about my condition, because I was a mess from the time I was pregnant. I was so sick that I was in ICU for 2 weeks. And I was actually in the ICU of ICU, like isolated, because people didn't know what was wrong with me. I was so thin, people thought I had HIV, and I was on like 9 concoction of medications. And all I had was a sickle cell trait symptom, which was more like sickle cell disease. I only had pain, sore throats, and low HB. And I kept losing HP. At one point, I think I was 6%, 67% when I gave birth. So for me, the journey was always trying to just, when I started talking, it helped me. And so the foundation of what we are doing today, especially the talks, came from, for me, it worked. And I just want to encourage some people out there that, sometimes talking helps. And I've seen people who have actually been out to speak about their condition that, they've actually been helped. So that was our lowest point. For the first 5 years, we never told a lot of people about our daughter's condition, except a few friends, until we finally started talking. And I started talking by opening a Facebook page. And we told the world, that, this is what's happening to our family. So that's where I came from. And that was not too long ago, 7 years ago. So that's where we are today. So that's just part of my story. Sharif, when have you been at your lowest point to be where you are today? Because I know you've also come out to be a very strong advocate, despite having, living with this chronic condition.
No, I think two things, several things to go on about my story. I think I will relate to what Timmy has said. As a person who was born with sickle cell disease in Uganda, it was a time where everyone thought you're going to die. So as a young boy who was growing up, I always felt like I was going to die. Like everyone literally said to you, oh, you're still here. Oh man, you're too sick last time. We thought you're going to lose you. And this was the talk like every other time. So growing up, actually, I knew that I wasn't really expecting, because you thought everyone thinks you're going to die. So it's one of those things that definitely worry you, definitely keep you worried and stressed up. But one of the key things as a young person growing up was my dad separated my mom because of my sickle cell, and all my time being sick, actually. This is such a funny thing but my dad didn't come to hospital to see me. Only once, when I was about 21, or I think I was about 22, I was in the ICU and had been in the hospital for like 10 days. After that, he came to hospital to see me for the first time in my life. And I didn't know how to react. He's like, you're not happy to see me? But I didn't really know how to react, because all my life, all the times I'd been sick, I'd never seen him there. So when he showed up at the hospital, he came to see me out of love and out of care, but I didn't know how to react. So that's one of the things that as a young boy growing up, there's a lot of mental stress and mental toll. But my biggest turnaround time was when I was in college as an undergraduate student. I was in love with a very pretty girl, and I wanted to marry her. I wanted to spend the rest of my life with her. And she found out I got sick and I missed school for like a month, and everyone found out I had sickle cell. I was trying to be very private about it. And that's the time she was like, you know what? Yes, I don't see myself with you, and I don't see myself with anything to do with sickle cell. And that was really my lowest times due to sickle cell. I felt so down. I didn't know anyone to talk to. I did not know anyone to go to. I didn't really know how I'm going to be able to break out and connect and be able to live a life. But after, I think, a few months of being very depressed, I found someone on Facebook was talking about sickle cell in Uganda. I reached out to him, and we founded the very first organization that we worked with him, Sickle Cell Network Uganda, from where, and that's where my journey as a sickle cell advocate started from. But it started from my lowest point in terms of I didn't know what to do. I didn't know who to talk to. I didn't know what to do. So from that moment, I thought, I need to do something about this such that other people who have sickle cell can probably not go through the same thing I've gone through. And that's was my lowest points. I still feel it today when I talk about it. All those memories come back to me, but I'm glad you talked about being able to open up and talk. I think that's a very important thing for anyone who's going through anything. Being able to share and let people know what you're going through is one way to help you heal and help you recover. So that was my, I hope I've answered what you asked, probably. Yes.
You mute.
Thank you. Yes, thank you so much. I think at this point, we'll have to sort of change the program a little bit. I'm mindful of Anna. And sorry, and your lowest point and how you came to writing your book, so that after this, we can excuse you, you can leave. I'll give you the floor now, then I'll bring in to Rachel. So Anne, take it up. Thank you.
Thank you so much. The lowest point, I think, probably they're different. I think for us, there's several lowest points when you live with sickle cell. Because for me, I am HBSS. So my lowest point is always being that leader to my two other sisters. When we moved back to Nigeria, one thing that always affected me was my brother died when he was 10. And my lowest point was when someone's, one of the ladies who used to help my dad look after us pulled us three girls into the room. And I was 8, my brother was 10 when he passed away. And we just moved to Nigeria. And he got sick. No one knew what was wrong. And the lady pulled me after he's passed away, said, "Oh, it should have been you, that you're the sick one, you're the problematic child. That why are you still here?" And that voice still sings in my head. And she said it out of, I look at her, I look back now, I say she said it out of, I was costing my father so much money to just keep me afloat, keep me alive, because when he was in hospital all the time, and there was always something wrong with me. And in Nigeria, system we have in Nigeria, it's not as easy system. It's a system where you have to pay for your healthcare. So my father will not only pay for my school fees, he will have to pay for my healthcare. And this was something he will always have to do all the time. So when the lady said that as a child, you don't think it gave you a low point, but it left a dent in me that I'm a dysfunctional child in a way that I have too many problems and I'm always going to be a problem to my family. But the good thing about life is that sometimes you let things dent you, but sometimes you just have to figure a way out and let that thing not be so much of an issue to you. Another low point I suffered was when after my brother passed on, I had to take on that responsibility of being the older child to my younger sibling. So that was challenging for me because, these are two girls here who are looking up to me to be this role leader. And I don't understand what the hell do you mean by someone have to guide you guys to be better people. I have my own issue to deal with, and what the hell am I worried about you? And my sisters, they all, with girls, you go through your different stage of life, you go through your different stage of puberty. So the girls are going through puberty and they're all going ahead of me. My body's not even changing in any sense. I am this little child, still a little girl at 14, still looking like a little girl. My sisters are way advanced, everything done. And that destroyed my mental health because not only am I older than these girls all look older than me. And I'm there. When people see me, they say, "Oh," they look at 3 of us. "Oh, say, this is your younger sister." I'm like, okay, guys, I'm not the younger one. I'm the older sister here. Get this, So I always had to prove myself. And these things gave me challenge, especially at then school. In the Sickle cell, we go through different, I tell people, phases of life that we go through. Then you go through the education part where it's so difficult as a sickle cell person going through school because you need to prove yourself, not just to yourself, but to your peers around you that you can do it. I went to school in Nigeria. It was so much fun because, Annette, I think you mentioned that you were right. In Nigeria, they beat you in school, but I never got beaten because they were always exam me. You just go over there. You're too skinny. You're gonna. All it takes is me to hit you once, and probably you'll never make it again. And I would just laugh. I'll be so happy because honestly, I don't think I could handle that beating if they had to come near me. Because one, I was so tiny. Honestly, I was so tiny. And I couldn't handle it. But that mental stress of always trying to be perfect in school so I didn't get told off was also a drain on me. So, with sickle cell, there was, Agnes, I don't know how to answer it because in my book, one of the reasons I wrote the book, and when I wrote that book, I had to delegate a session to mental health was because I never used to assume sickle cell had anything to do with my mental health. I just thought, I'm in pain. No big deal, you get over it. You're in pain, get over it. But when I sat back and looked, you're always in panic attack because when you're sick, you have to call your boss. And then your boss will ask you, why are you sick again on Friday? And I was sick. I don't know what to say. Call my hospital and ask him. And when you're sick, you have to explain it to someone in a relationship. Oh, by the way, I don't know if I could date you because I am sickle cell and I don't know how you're going to take me. I remember I come from a family where it's the right thing they say to do is to get married. So I've always had this in my mind. but I'll meet my fellow Nigerians and I'll be so excited, wanted to date them. The first thing they'll just tell me, darling, you're sickle cell, we don't go near you. Like, okay. So that affected my confidence. That always made me low. That I remember going into hospital, I missed a big business trip. And I told the doctor, I really don't think it's worth me living, because everything I try to do, no matter how hard I work, people say, yes, with sickle cell, work harder. Yeah, I work harder, then the sickle cell throws me back 20,000 miles. I'm like, this is not doable. This is it. I have to end it. I can't do this anymore. And as Annette said, it was the former president of Nigeria who actually, he reminded me that life is what you make out of it. Obasanjo said to me that, and I sent him a message and said, this is it, I have to go now, I'm done. I was, people think, okay, you think you could get over this phase so easily, but it didn't happen that easily for me. I got to that phase in my life where I said to myself, enough, I can't deal with this. My sisters are all successful. Everything they put their hand in, easy peasy for them. For me, I have to work extra hard. And every time I work harder, life bounces back. Then he reminded me that where I come from, which is Nigeria, there's a burden of sickle cell, but there's also other people suffering from basic necessity of even just putting basic food on their table. Some people can't even eat. So that mindset stayed with me and said, actually, it's true. I'm even having an opportunity where my people could pay for my own hospital bill. What am I complaining about? God has been good to me. He's given me good kids. He's given me, no man wanted to marry me, but I found a husband in the end that really understood me, that took me as I am. I told him, I remember when I met my husband, I said, I have sickle cell. He said, and honestly, we all have problems. I have my own liability as well. So don't worry about it. We all come with liability. Nobody's perfect. And because in my mindset with sickle cell, I knew that I'm not perfect, but I always thought everybody else was perfect. I didn't realize this actually. Nobody is perfect. Everybody has problems. And the day I started understanding this key point, that actually is true. Nobody is perfect. Even your boss who's giving you a hard time, when you sit down with him and talk to him, he's actually going through his own issue that you have no idea. So in a way, sickle cell made me selfish. And my sisters always complain about that about me, that it made me selfish. I always used to think about me because I was always sick. I always saw me as the sick one. But what I forgot is that other people have their own issues. And sometimes issues are not about you, issues about other people. So when I reversed the communication, reversed the tagline, I tell you guys, life changed. There was no more mental issue. The only issue I saw was issue of other people, because if you don't accept me for me, then I'm sorry, then you just missed the boat. There's an answer. And you always have to remember there's 7 billion people in this world. If A doesn't want you, look, there's so many other people who would eventually find, and you eventually find the right person that you look back and you say to yourself, oh gosh, what was I even doing with this guy? This person was just not even, it would have never even walked. It would have, like my husband and I, we've been together now for 20 years. And through him, we've understood the process of being a sickle cell. He understands sickle cell. He's not even from Africa, but he understands sickle cell more than I do, because God finds the right person for you. And as much as people try and avoid that subject, we must never forget sight of your faith and your hope in whatever it is, whatever you believe in. That destroys all mental doubts you have. And the day I let go of that, and I said to God, I've deleted that doubts. Life was just a positive stream. I've not had sickle cell crisis for almost 4 years now. And I'm HBSS. My HB typical run on 6. And if you do my blood right now, it'll be 6. But I've just not had a sickle cell crisis. I've not been unwell, because I've just believed that if you focus on you and reduce the wants and focus on the needs, if you don't get a job, reduce your income, reduce what you're paying, just make your live according to what makes you happy. Don't try and make things too complicated. And that was what my book was all about, to make life easy for people so that they could go from that pit where they felt pity in themselves to that bit where they find joy, and we live by real example. Because I didn't want to say, come out here and say, yes, I'm successful, but yes, I'm happy, and that person's not really happy. I wanted to, when you look at my page, you even know I am very happy because I live with the minimum. I live to what I can do. I don't stress myself. Even if my sister knows, if Anne can do it, I say no. Even Agnes, when she said, I said, look, I could do this, but I don't let anything get to me, because remember, mental health is all about stress. And when you're stressed, you get sick. So you have to know the trigger points in your relationship.
Know your limits. Yeah, know your limits. Yeah.
Yeah, that's me. And I just hope that that message really helps someone out there, that it can be done. And this is why I wrote the book, to really reach out to more people and to share my story of being positive, and to not let the pain or the disadvantage that people have thrown on us, that we can't do this, we can't achieve, we can't do that, we can do all that we set our mind to, but we just must know our limits and when to say no.
Thank you so much, and thank you. Before I bring in Rachel, I just wanted to read you this article that I found in preparing for this topic. So I found this article by Monica R. Asanani discussing sickle cell disease and mental health. So, what she said, she says individuals with sickle cell face many psychological, emotional, and social challenges. The pain crisis, which can, I'm directly quoting here, and she says, the pain crisis, which can begin in their childhood, may result in frequent hospitalization and absence from school or work. The unpredictability of severe attacks can lead to fear and anxiety. Individuals experience more fatigue, low energy levels, and hence may not be able to participate in sports and other physical demanding activities. All these things can lead to a sense of isolation, loneliness, and depression. Many people require strong painkillers such as opioids for relief, and are often wrongly accused of being drug-seeking by families and healthcare professionals. Often because they have a lot of fear of facing this stigma, patients do not want to seek help. This may lead to severe life-threatening problems being missed, and they may present late to hospital for care. So hence, those individuals who have more psychological and social problems and also have more severe complications related to the disease. For example, individuals with sickle cell who have greater emotional and stress-related problems have more frequent and more severe pain events. So this was a study that they did in Jamaica, and looking at all these things that the article talks about, isolation and depression and loneliness. I want to now bring in Rachel to look at how to manage. Finally, I found the presentation, Rachel, to see how you can manage these issues that come with all the issues that go with your physical health, how you can manage your mental health. And then we'll see if we go back into answering the questions after this presentation and see how you've dealt with it. And I've seen questions here like, Timmy, I think you only told us a little bit about what you've experienced in life. I think we'll come back to discuss that. And Dr. Ankisheti has reminded you to speak about the bullying that you went through. So that will also be covered in the presentation, and see how you can deal with that. Then we'll go back to the questions. So right now, Rachel, I will share the screen for your presentation. Can we see that? You're mute. You're mute, Rachel.
Yes, we can. Yes, we can see it.
Okay, thank you, Peter.
Sorry. Okay, that's all right. Thank you so much for having me. And I'm going to be talking about the effects of sickle cell anemia, but half of the slides are going to be covering on the treatment that is available for people that are having mental health issues as a result of having sickle cell in their lives. So I will try and be as fast as I can. So as you can see on the first slide, we've got the different shapes of our red blood cells. The red ones are supposedly the normal blood cells, which are round, and then the ones that are kind of like a sickle or a moon-shaped, they are the kind of cells that people with sickle cell anemia tend to have in their bodies, in their body parts. We'll explain that phenomena further. So the background information about sickle cell anemia. Sickle cell anemia is one of a group of disorders known as sickle cell disease. So what we're saying is that there are variations, and I'm sure if you've been working with your physician, you possibly know what variation or what prototype that affects you in your own life. In sickle cell anemia, the red blood cells are shaped like sickle cell or crescent moon instead of a normal round shape. They sometimes get stuck in small blood vessels. As a result, sickle cells die easily in people that are affected. They sometimes get stuck in those small blood vessels, and a shortage of these red blood cells then reduces blood and oxygen circulation, causing fatigue, and for other people faint. The normal round blood cells are flexible in nature, and they move easily in our blood vessels, supplying enough oxygen to the parts of the body. Sickle cell anemia, it is an inherited blood cell disorder. So it's not something that you can catch as a result of being in contact with other people, but you're born with it. There is no cure for most people with sickle cell, but there are treatments available that can relieve pain and prevent other complications such as chronic mental illness or any other related conditions. In most cases, the onset of sickle cell is usually at the age of 9 months, but for different people, things vary. Some people start to see the symptoms a bit later, some a bit earlier. So like we said that the sickle cell, they die easily, which causes the shortage of red blood cells and reducing oxygen circulation in one's body. That can be a big issue in most people's lives because you can either faint or sometimes you find yourself with no energy to do some heavy work. And symptoms of sickle cell, we're talking about episodes of pain. Every now and then, people with sickle cell, they have pain in the different parts of their body. And sometimes when the sickle cell blocks tiny blood vessels in the chest, in your abdomen or the joints, this is when you can experience lots of pain. And this pain varies in intensity and lasts for a few hours or a few weeks or sometimes days, depending on the type that you have. It sometimes causes the swelling of hands and feet. When sickle cell shaped red cells blocks blood flow to the hands and the feet, you can find yourself with swelling feet or swelling hands. People with sickle cell often suffer from frequent infections. So sickle cells can damage the spleen, and they can also increase your vulnerability to different infections. And children with sickle cell can receive vaccinations and antibiotics to prevent other infections such as pneumonia. An earlier speaker spoke about delayed growth. That's another symptom of sickle cell. And mostly people with sickle cell reach puberty a bit later than others. And a shortage of healthy red blood cells slows growth and delays puberty, which can be a cause of mental health like we've heard before. It can also cause vision problems because when the sickle cell cells plug the tiny vessels in the eyes, they can damage the retina, which processes visual images. So you can end up with eyesight problems as well as a result of having sickle cell. How do we manage mental health when we have sickle cell? So the first thing that happens with most people that have sickle cell, they experience what we call grief and loss or bereavement, a sense of loss, a sense of missing out on having a normal life. And with that, people go through a series of emotions, and we will learn a little bit more about bereavement as we go. And people with sickle cell often suffer anxiety. We have heard so many people that are being bullied, that were being bullied, and people are anxious about going out there for fear of being bullied. And sometimes they are worried about their looks because they possibly don't look as older as they're supposed to be. We've heard that before. And depression is also very common amongst people with sickle cell. Post-traumatic stress disorder is one of the major ones as well. We will go into that. And insomnia, lack of sleep, can be an effect of having sickle cell. What are the psychological interventions that are available for people with sickle cell? So we have what we call psychoeducation, which improves the knowledge and understanding regarding the illness. I think we have had other people saying that when they came out in the open and when they started to connect with people with sickle cell, by having more knowledge about the condition and by understanding how other people are coping, has actually helped them to cope better. So we can also engage in what we call support groups, which is what this organization is all about. And during those support groups, this is when we have what we call psychoeducation sessions, which forms the client's support group, enhancing your motivation through shared experience, through shared experiences. We just heard one of us saying that, you know, they're still making it in life. They've gone to university, they're doing business. So just knowing that some people out there are still fighting through sickle cell and still do things in life can be a way of helping you in terms of managing your own mental health. Psychoeducation benefits the affected person and also the family members. I think we have had people that have been rejected as well by their boyfriends or people in the community because they had sickle cell. But then if people are educated about the condition, people will be able to support their family members and their friends. And the other way of managing your mental health is to engage in what we call trauma counseling. So what we need to do is we need to go and see therapists, psychologists, counselors, social workers, school counselors, depending on whoever is available to you. Because most people experience trauma as a result of losing consciousness in public places. And sometimes people fall in dangerous places actually, and then they actually experience real physical trauma hitting their bodies because they fainted in the wrong place. One of the major therapies that we use in treating people with chronic disease, including sickle cell, is what we call cognitive and behavioral therapy, which comprises of two approaches, which are cognitive processes and behavioral techniques. So with the CBT premise, we are saying that difficulties in living or in relationships, difficulties in general health, work, they have their origin in thoughts, emotions, and behavior. And so the aims of cognitive and behavioral therapy are to challenge and change inappropriate self-defeating thoughts. And we're also saying that behavioral methods, the behavioral methods premise is that inappropriate behaviors are learned and therefore can be unlearned. So as a result of being sick, people have a tendency to become comfortable in the limitations that they've given themselves. So we are saying we can unlearn those things and get out there and do life as much as we can. And we also aim to provide strategies to manage pain and distress. So pain is physical, but distress is emotional. It's a mental health status at that particular time, which is often common with people with sickle cell, that they have distressing moments in their lives. And it also aims to improve mood and psychological coping ability. CBT can be offered to patients with sickle cell individually, or you can attend group work and you can do the therapy in groups. It is also important for someone with sickle cell to be able to access neuropsychology. A neuropsychologist will do an assessment just to see if there are any neurological impairments, because we know the sickle cells get stuck in veins, they get stuck in the wrong places. And some people might even end up with blood clots that could cause what we call acquired brain injuries for some people. So getting an assessment as to how much damage would have been caused if anybody has had a clot before will actually help. And a comprehensive neuropsychological assessment might be used as a basis for CBT treatment. So your therapist will be able to know what to do with you. The strategies that are involved in CBT are, during those sessions, you need to learn how to identify the unhelpful thinking patterns. So your therapist will expose you to what we call unhelpful thinking patterns or thinking errors. There are a list of them that you learn about, and then you can be able to identify with the ones that you normally engage in. And after identifying those unhelpful thought patterns, you will be able to learn how to challenge them. There are strategies like evidence checking, perspective taking, consequential thinking, especially for those people that sometimes feel like committing suicide. You might need to do CBT so that you know about the consequence of that. And also your therapist will also help you with strategies on how to adopt helpful ways of thinking. And not only does therapy help you to learn to manage unhelpful thinking, you're also given what we call emotion management strategies. And the aim of these emotion management strategies is to increase distress tolerance. Having sickle cell will put you at high distressing levels. And having emotion management strategies will help you to manage that distress and be able to tolerate that distress without hurting yourself or without giving up. And these strategies that you will learn in therapy are mindfulness, relaxation, breathing exercises, progressive muscle relaxation. And for those of us who cannot access therapists, you can also buy self-help books that can help you to learn these strategies as well. And then we have what we call behavioral strategies to manage sickle cell. This is when you need to take responsibility of your own recovery. When we say recovery, we are saying there's no cure, but you can recover from episodes of distress, from episodes of pain. How do you go to that road to recovery? The first thing is try and schedule pleasant activities. What do you like to do? We have had our doctor saying that she knows about somebody who would get into music. That's a pleasant activity to soothe the pain and to take your mind away from the pain. So adopt health habits. For example, soothing activities like showers, bubble baths, hot water bottle for pain soothing. Music is one of them. Exercise to produce endorphins. Endorphins are a hormone that helps us to be happier in life. So exercise can help as well. Use distractions such as watching television, watching movies, or comedies. I love comedies because they make you laugh and also produce more happy hormones like endorphins. Creative arts, music, gardening, to mention but a few. So the last thing when you're managing your mental health, when you're experiencing sickle cell, is resilience building or resilience planning. We have heard someone's story already where they were saying that they know what they can handle. It's also part of resilience building. Set realistic goals in your life. And some of the things is to accept that this is what it is. Try and comply with your regular medication. That if that medication is for mental health, comply with it, or for any other symptom that you're being treated for, comply with that. Learn about your early warning signs. Know when you are likely to have an episode. Once you know that, adjust your working life, adjust your life so that you can be able to rest and be able to give yourself time to recover so that you don't go so far in distressing situations. Talk to someone as soon as possible. And this someone could be a professional, a psychologist, a social worker, a counselor, a church pastor, pastoral care, a family member, or a peer. And those of you who are part of the sickle cell organization, find someone who you can be able to debrief with. And also include the steps that you need to take when you experience symptoms. For example, see your GP, your psychologist, your counselor, mental health social worker, mental health occupational therapist, mental health nurse or psychiatrist, or a pain management clinician. We are also aware that in Africa, sometimes these professionals are not available, or they are available, but they're not within your reach. Make use of what is available to you. If you have got a school counselor, go to that school counselor. If you have a pastor or a pastoral care person, go to that person. If you've got a friend who you can debrief with, that can help you. But above all, try and get as much information on self-care in terms of mental health. You can buy books, self-help books that can also help you. If you get suicidal, you need to know your local mental health crisis number. I think in almost every nation, we have a mental health crisis number where you can talk to someone so that they can do what we call mental health first aid, and so that you can be able to better cope until you are back on your feet. And try and organize your work, sick leave, work the number of days that you think you are able to work, so that you do not panic, you don't get anxious when things are not working for you. And it's also important to notify your bosses, to tell them that I've got this condition, so every now and then I might need to take time off work. So it's always good to put your information out there. And coming out in the open always help the people around you to support you. So thank you so much.
Thank you so much, Rachel. Thank you so much for that good presentation. I think at this point, I want to go now into our clinical management, and we share our experiences and see how we can suggest with our different respective countries or respective clinicians, how we can be helped as people living with sickle cell disease, but also as caregivers, how we can help for that help. How can we ask for that help? Dr. Ankishet, in your practice, do you feel that you are doing enough, or other clinicians are doing enough to help people living with sickle cell disease? And if not, what can we do to try to start closing this gap?
Now, in the current situation, when I'm speaking, I speak from the point of view, from the perspective of working in my own space, in the Nigerian environment. Okay, we're still at this time at a stage where we're pushing for a proper policy for the control and management of sickle cell. We have come up with guidelines for management and control of sickle cell, but it does not contain anything on mental health. So we're just saying we're going to have to review that. We had a meeting on Thursday and said, aha, it's time we reviewed this handbook, this manual for management of sickle cell, and it must have a whole section devoted to mental health aspects. It's so important. I remember we're also advancing in management of sickle cell to a point where we have cure. We have a cure for sickle cell now in the form of stem cell transplantation, and it works. It may not work all the time. In fact, I know that the doctors who do this are very selective of the patients they take on. There are certain criteria, and they have to check the boxes. Are your crises more than so and so in a year? Is it better? Because it's not a stroll in the park. Is a very extensive procedure, and it can be risky as well. But do you know that persons who, I'm sure you can share with us, Agnes, I'm not sure what your daughter's experience has been, but I've had to speak with a few people who have had bone marrow transplantation and are very well now. Physically, they're really well. The young ones have caught up in their growth. They've shot up in height. And I think I shared a couple of slides some time ago where a child who was stunted in a year and a half was over 6 foot tall. Anyway, in post bone marrow transplantation, they have mental health issues. They're dealing with issues because the young man who I spoke with Tuesday during the week said to me that I'm so used to, getting up in the morning, taking my medicine. I have to do this. I have to get a check with my doctor every month. I must go and get my blood transfusion, my top-up transfusion, because he was on chronic transfusion, and he's not having to do that anymore. His life has changed. It's what we would think. Come on, you should be happy. You should be. But he's you know what he said to me, Doctor, I'm feeling depressed. I could not wrap my mind around it. why are you depressed? So I said, no, don't speak with me. I'll hand you to, because we have a 24/7 counselor's phone call, So she was able to talk with a counselor who referred him to a clinical psychologist. So he's seeing that therapist now. That it has to be part and parcel of that treatment of that so-called heal. It's so important. So right through the gamut and spectrum of care to the peak, to that top of the apex, I would say is the cure for sickle cell bone marrow transplantation. That they're so important. So in what we do, we apart from our usual genetic counseling, we have now added clinical psychologists to be able to take care of persons who have mental health issues. They have those issues. We have to address them. We have to sometimes seek out, ask, and not wait for them to tell us. I shared with you about siblings in the family. And then again, sickle cell is not a condition you manage with an individual alone. You manage the entire family. So when you're counseling, you counsel the family. Sometimes other siblings are jealous of a child who has sickle cell because they feel the parents are paying so much attention to this particular child. I have a real life situation where one sister, a younger sister, who was fit and running around and everything, said to us that, well, her parents reported that she tried to stifle her sister with a pillow. This is real life, and snuffed the life out of her. Why? She was jealous. Listen to this. She said in the mornings during Hamatan, that was what she said. They live in a place in Nigeria called in Ife, cold part of the western part of Nigeria, and that her parents would have her bathe with cold water. She said it was ice cold water, but they would have her get hot water for her sister who had sickle cell, but she would not bathe with hot water. So she found that was discrimination. So in the end, we brought them in as a family for family counseling, and then made her in charge. It was not a one-off process. It was continuous counseling, not a one-off process. Everyone is involved. So you take care of your sister as well. So when we're taking care of those who have sickle cell, remember that the family, the siblings, also require that extension of mental health care.
But that's a one-off, right? Danette, that's a one-off. It's not something that's like we are talking from the Nigerian perspective. It's a one-off case where this person, or maybe the mother, has sort of come and told you the problem, then you act. But it's not part of the treatment plan. And what we feel is from the clinical perspective, that should be something that should be in the care plan for someone. Check in every 3 months or so to evaluate how you're feeling, and don't wait for a caregiver or a patient to ask for mental health help. I want to bring in and
the caregivers in the plan, in the management plan, the caregivers also have to ask. Even when your patient does not ask, look, it's part of the protocol. Ask in your checklist. Besides the medical, your checklist must also include mental health aspects. So that's what I'm from.
Exactly. So